COVID-19 pandemic has greatly disrupted everyone's lives. Clearly, its effects vary considerably for people of different race, ethnicities, and indeed income levels. But what has been the impact on people with disabilities? For instance, children and teenagers with a wide range of developmental, physical, and behavioural needs have been very severely impacted. Ongoing harm caused by the pandemic, rather caused by the government's inaction, or action, as I said earlier, has been especially evident for people with disabilities. Disruptions in education, employment, healthcare, social services have been amplified. Parents took full-time caregoing roles, while also stepping into new roles as special educators, speech therapists, behavioural therapists, and more. This has been exhausting, frustrating, and often just not possible for many families. July provision should be just automatic this year. There shouldn't be any real hassle with getting this, but our systems are cumbersome. Also, the school bus tickets, the mess, the mayhem is starting again, year after year after year. A dysfunctional Department of Education, and that they can't have these kind of things sorted out. Programs and social lives curtailed. Many people who have intellectual or physical disabilities require highly specialised programs, and indeed one-to-one direct support to be safe, to learn, to work, or perform daily living skills. So some may have more difficulty using technology or learning and working in a virtual world. For many, their social life is solely through schools, employment, or community programming. So the effect of limited social networks during the pandemic has an extreme isolation and especially difficult. Unbelievable. It's hard to believe it. With Ireland in, and we're signing up to United Nations, UN treaties and conventions. But it's been a daily struggle. My late brother was a paediatrician. He's gone now since 2011. God help us, 2006, and he championed this, and he was a paediatrician, and I meet families still that miss him, Dr. Mattie McGrath, but the battle for people, for families, they have a profoundly disabled child or with whatever learning difficulties, and they have to fight for every morsel of support. To have waiting lists of 1,400, to have waiting lists of years. It's callous. I'm not blaming you, Minister, now, but I'm blaming successive governments. We talk about it, we sign up to the conventions, but we do nothing about it. And we have, massive dysfunctional HSE admin staff. We have massive dysfunctional, we have TUSLA and other agencies. And there's some great people within those organisations, but they get frustrated. And if they're trying to make change, they'll stop, get back into your box and do this and do that and the other. And the whole situation now, and I want to compliment the people that did go into work and did work and got services going, but there's lots of public servants now out there and they're not pulling their weight. They need to get back to work and get the system that's clogged, the agricultural system, the many systems, there's just nothing happening. They're not even opening an envelope, the passport office, the driving licence, the theory tests. Some of these people, need their licenses to be essential to drive some of their children with intellectual or physical disabilities to school or to play or to special playgrounds. And I salute from the bottom of my heart the Mahars, the Ahars, and the mothers and fathers and families and siblings and the communities that are trying to work. We in Costa New and Ashura have set up a wonderful organisation pre-COVID, Positive Steps Together, to try and put a building and a resource centre together give some respite to some of these parents. And we were going great, and I must say there was huge enthusiastic support and an outpouring of support, and we raised a considerable amount of money in a short time. But along comes COVID, and everything has stuck to the ground. No meetings, no HSE visits, no interactions, no planning, no nothing. So we need to, as I said earlier, Chairman, we need to, with 63 patients in hospital last Monday, and 67 and 23 in ICU, we need to let our country live again. We need to get the cabal of NPHET off our backs and let us live, and get the government to take control and get the government to look after all the people, but especially the people suffering with these ailments. And let us live again. We've been the fear and everything that's been driven into us. And I see the debate now about the antigen tests. This will all come out in the international investigation that I'm calling for, and we'll be seeing the gaping failures, and we'll be reminded then of the cervical cancer smear and what happened. This is shocking. But above all, this area here needs to be dealt with, because these people deserve, and the anguish and the pains that were ringing us all TDs got called for the pains who couldn't cope, and everything else during the early days of COVID and all through last year. And I think this continuing again 15 months later, and if never get their way, it'll continue into the winter and over Christmas.
Thank you, David.
Thank you.